Hello everybody from Dr. Stevens, it's Roisin here, and we've Dr. John Fitzsimons and we've Siobhan Reynolds with us today for Quality and Safety Walk-Arounds. Thanks a million to Siobhan and Dr. John Fitzsimons for taking me out of a bit of a hitch because of the last minute cancellation. So really delighted to have them with us today. They're both really experienced in quality and safety walk-arounds and are going to give us some of their experience from the last 2 years' work in this area. So I'm not going to go into that. You've probably seen it from the flyer, but both people are really interested in quality and safety walk-arounds and extending those around the country. We want to keep it as interactive as possible, so use the chat box function as much as you can for any comments and questions or ideas throughout the WebEx. And without further ado, I'm going to hand over to John and Siobhan.
Hi, thanks very much. So today we're hoping you gain an understanding of shared concepts around quality, leadership and culture in relation to walk-arounds, approaches to carrying out walk-arounds, and I suppose it's important just to state that this is just one approach to setting up a walk-around program, and there's lots of different ways of doing it. The critical success factors of quality and safety walk-arounds, so what kind of things need to be in place to make it an effective and efficient program, and how to set up the quality and safety walk-around program.
Yeah, and I think we're looking forward to seeing some of the comments coming through and people's questions, and we'll try and address those. And as Siobhan says, this isn't something, we're on a learning kind of journey with this as well. And I think internationally, I think the evidence is only emerging in this, and this is, I suppose, one of the ways we've interpreted, I think, how to do this, and we'd be keen to hear of other people's experience as well.
So a good really place to start just is to look at a definition around walk-around program. So this is the HSE definition, a structured process to bring senior managers and frontline staff together to have quality and safety conversations with the purpose to prevent, detect and mitigate patient and staff harm. And I think the key word there is a structured process. It's not an informal process. And also it's about staff engagement by bringing frontline staff and senior managers together to carve out some time in a busy day to have a conversation about quality and safety walk-around. Just to give you some background to the walk-around program, if people are interested in seeing where they originated from, they came out of a 2001 conversation by Dr. Alan Franco from the Institute of Healthcare Improvement. And he devised a walk-around program, and it was in relation to medication safety and developing and designing a medication safety system. And walk-arounds were called patient safety leadership walk-arounds. In the NHS, as part of the Patient Safety First campaign, they call them patient safety walk-arounds. And you hear terms such as executive walk-arounds or leadership walk-arounds. So here in Ireland, we call them quality and safety walk-arounds. It's worth looking at both what they are and what maybe they're not. As I said, they're a planned, structured discussion. It's an opportunity to identify good practice. It's an agreed schedule of walk-arounds. It should be regularly repeated. And it's where frontline staff do their work. So it's not in meeting rooms or boardrooms. It's meeting staff in frontline areas. And it should really be supported by if there is an existing quality and safety function within an organisation. Things that maybe just to consider what they're not, as I said, an informal meeting. It's not an inspection or an audit, so they shouldn't be tagged onto existing audit programs. And it's not just about safety concerns. As we said, it's about both quality and safety and looking at best practice too. And so why would an organisation set up a quality and safety walk-around program? Some people set up the program really to demonstrate senior leaders' commitment to quality, to build on existing staff engagement programs, and as we said, to identify, acknowledge and celebrate good practice. So it's looking at those pockets of excellence within an organisation. It strengthens commitment, and it supports the development of an open culture for safety. And it's also a way of increasing, I suppose, the existing information flowing in on patient safety in an organisation and building on that and increasing that in-basket of patient safety information. Just to put it in context, some people might be familiar with this document, which was launched in 2015, and it was a case study and toolkit that we did in the Quality Improvement Division and the Royal College of Physicians toolkit and resources, which was launched as I said, in 2015. And it really was just a guide for organisations who maybe would be considering a walk-around programme. And more recently, late last year, we've done some work with social care older person services, and they've looked at how you could adapt an acute toolkit for an older person services. So we've done some work with them. And we've also this year done some work with Cavan and Mayo hospitals around their walk-around programme. Here's just an overview of the guidance and what we've identified as 7 steps to setting up a walk-around programme. And that document is available on the HSC Quality Improvement website. So maybe we just go into how you go about setting up a walk-around programme within your organisation or service. I suppose there are a number of key tasks which we've identified, and I suppose one of the biggest tasks is really to identify a dedicated resource or somebody to coordinate the programme, setting up your annual schedule, confirming your walk-around teams, getting information out to staff prior to the walk-around programme, looking at developing some ground rules or ways of working within the walk-around team, and how you're going to report back actions as a result of the walk-around programme, and also to reflect on how you're going to measure the effectiveness of this programme. How do you know that this programme is working for you as an organisation? So there's some of the key tasks that a walk-around coordinator might consider as part of a larger group of walk-around teams. One of the areas that we suggest to organisations, and it's part of the Beaumont case study also, is that the organisation does some sort of safety culture assessment within their organisation, and it could be through a survey or maybe through using an agreed culture assessment tool. So an example that we would use as part of our training is the Manchester Patient Safety Culture Assessment Tool, and it looks at an organisation over a maturity model from A, so an organisation really that would ask, well, why do we waste our time in safety, to E, a general that would look at risk management as an integral part of everything that they do. So we would suggest to organisations that they would have some assessment with regard to their safety culture prior to starting a walk-around programme. And then as a result, then at the end of a year or maybe 2 years of a programme, you might go back and look at assessing again where you are maybe against an evolutionary model. There are 3 phases with regard to setting up a walk-around programme. One is in relation to preparing, then it's actually doing the walk-around itself, and 3 then is following up then in relation to the walk-around action. So one of the questions that we get asked a lot is how many people should be on a walk-around team and who are those people? So some examples are a CEO, general manager would lead the walk-around team. You'd have lead clinicians. You'd maybe have other members of your executive management team. And maybe to support the walk-around team, you might pair clinical with non-clinical staff. Or in some organisations, for example, in the older person services, they invited a general manager to join their walk-around team. And we've seen examples where board members have joined walk-around teams. And also it's important to have somebody to take the notes of what has been agreed. But the key thing, I suppose, is that your numbers are small and you shouldn't outnumber the team of the frontline team that you're about to meet. And then also was asked about who should be there on the site team receiving the walk-around team. And the lead clinicians should be involved in it, and it should be a mixed group of staff, maybe up to 5 members. And the key thing, I suppose, is the location, and if it's somewhere suitable nearby a clinical area, if that's possible. Communicating prior to the walk-around is really important. There's an example of the Beaumont posters that they placed up around the organisation, and you might have a communication plan, so use your existing communication structures, creating your schedule up front for the year, informing staff, and coordinating the visits, so setting the times and dates. So what happens during the walk-around? Some of the steps that we've identified is that you would do an introduction, you have a site tour maybe, follow a set of agreed questions, and then close the walk-around. So I don't know whether, John, do you want to talk about this stage in the walk-around process? The team should really meet. prior to the walk-around to discuss their approach, to discuss their roles, who's going to lead the walk-around, who's going to take the notes, and maybe agree on some kind of key broad questions that the walk-around team can agree on. Visit the area, introduce the staff. In some cases, you might know the staff that you're meeting. And what we've worked with in some teams is they have developed an opening statement, so something to start the walk-around. And they also have agreed a number of set questions. It's really important that one person keeps an eye on making sure that everyone gets a chance to speak, and that maybe that everybody has a chance to maybe get the questions said during the walk-around. Then just confirming your actions that you've agreed with the walk-around team, and then finishing the walk-around and explaining, well, what's going to happen next? What will we do next as part of the walk-around?
That's something I think when we do the training, we spend a lot of time is preparing people for this first visit. And I think probably each walk-around you do, you learn, and we try and give people, again, some tools such as after action review to try and learn further from the walk-around. But I think people are often anxious about this because, and I think certainly the people who are being visited are often anxious about this as well, because even though you might tell them this is not an inspection or that they're being audited, it's very hard for them always to believe that. I think that the visiting team needs to go out of its way, I think, to assure people of that. I think one of the things we've had in the training very useful is to do some mock scenarios where people, imagine that they're going to be the visiting team and the receiving team. And again, that's where your thing about the having the kind of set questions or opening statements can just help get over those first visit nerves, I think, and put everybody at their ease.
Just wondering, it might be appropriate now to ask, you mentioned earlier, Siobhan, about the walk-around coordinator.
Yeah.
Maybe you might just explain a little bit more about what that role is.
Yes, I mean, the walk-around coordinator would set up the schedule, agreed schedule for the year. They would support the walk-around team, both the team that's going out to do the walk-around and also those who are maybe on the site and have queries and questions. So they would look after the communication piece around walk-arounds. And in what we've seen in some organisations, the walk-around coordinator has acted as scribe for all of the walk-arounds, and it just keeps that kind of cohesive approach. So it's usually an extra part of somebody's job, and it's not a full-time job, but it is, there's an administrative role. Yeah.
And in the organisations that you've worked with in implementing the quality and safety walk-around, has there been like an agreed chairperson or person who would kind of facilitate the walk-around each time, or does it change?
It's usually the most senior person that's doing the walk-around. So, for example, in Beaumont, it was actually the CEO who did all of the walk-arounds, but in other sites, it would be different people who would lead the walk-around. Yeah.
So I think the published guidance is very good at outlining those roles, and like Siobhan said, I think that having key roles is really important, because one of the most important things here is that there's a trust and reliability. So if you say you're going to do a walk around, that you turn up, and of course stuff happens all the time. People get stuff in their diary that they weren't expecting, and you have to be able to ensure that somebody else can fill in, or ideally, really that your walk around is a priority, and
it doesn't get cancelled.
Yeah, exactly. And what you're trying to do is show people this is very important to us, to the senior leadership who are going to go and in one sense honour the work that's been done, so that they're going. And that's kind of the attitude we try and get people to look at bringing is they want to go out to really learn about all of the good things that are happening on the day-to-day basis. So I think being organised in the background, I mean, I think this may not be visible to the visiting sites, but being organised in the background where, it's reliably going to happen, people you need are going to turn up, it's going to happen in a certain fashion. And then, really importantly, I'm sure we'll talk about this in a moment, that anything that's agreed on the walk around is actually carried through. That's critical, I think, again here for the team who's being visited to have faith in the whole process.
And maybe one more question, perhaps people online wouldn't be familiar with the guidance, but you talked about the guidance that has been, it's up on the website available for everyone to have a look at, but see the questions section there. So in the guidance, are there like templates of questions for people to work through?
So as part of the training, what people have done is they've taken the Beaumont questions and they've either adapted them or taken them the way they are, adopted them straight away, or they've adapted them to suit. So I know in the work we did with the older person services, some of the feedback we got was that they felt the questions were very formal and they wanted to adjust them. So yeah, I think the customization is a key part of this. And as we said earlier, there's no one set approach to it, but consistency, I think, is key. And so just to agree the questions in advance and what suits your organisation and what suits kind of the way you normally would do business within your organisation. Yeah. So some of the questions people would start with is, well, what do you do well here? Tell us a little bit about your service, if they didn't know each other. So what quality improvement activity is here within this unit or service? What concerns you? What are the key patient safety issues within in your service? This type of opening questions. And the questions we've presented in the Beaumont case study is there questions for the teams, such as equipment, facilities, people. There's actually a few questions in if you were to meet maybe a patient or service user, what type of questions you might ask. Is that okay?
Yeah. Thanks.
So after walk around is something I suppose just to consider as well, looking at what immediate actions need to be followed up, the tracking and monitoring of what has been agreed, how you feed back to a unit or service. You might decide to do a follow-up visit. In some walk around programs they agree to follow up maybe within a year. And then how would you maybe measure the effectiveness of the program? So usually is an agreed number of days that there be follow-up. So the scribe will write up the notes, send them back the key actions. So what we would suggest, maybe people would take 3 to 4 key actions as a result of the walk around. There might be lots and lots of actions, but maybe as a team you would prioritize those actions. Send them back to the team, agree on the actions, and that you'd have some sort of database or central repository of all those actions. So what's really key is that walk-arounds are not considered something that happens outside the existing structures within an organisation. So you either put it on a standing item, maybe on your management team agenda, where we see it normally as in the quality and safety committee, and will be part of that. And then you have some system of closing the actions and feedback on whether the actions are open or closed, and looking at trends. So you'll see from the, say, for example, there's an example of an action plan that Beaumont used. So you can see the key, three or four key actions are identified, and there's a review date to follow up on those actions. And sometimes then some organisations categorize those actions under key themes, so communication, environment, training, teamwork. So you can categorize them in some way so that you could develop a report for existing committees or governance groups within the organisation. Another thing which is part of the training is in relation to the walk-around team doing a form of an after-action review. And it's really just to look back and quickly to see how well the walk-around went. Was it actually what they had set out to do? What happened? And is there anything that can be learned? And we would suggest that walk-around teams have a space that they can go back to and just to share what's working well, what's not working well with regards to walk-around. So it's not just about the actions, it's also about the actual walk-around process itself. There's just an example of the process flow that's available in the case study, and you'll see that the phases: communicating your schedule, actually doing your walk-around, and tracking and reporting on trends. So some of the critical success factors that we've identified with regard to a walk-around program is executive sponsorship and leadership around, and also that it's clinician engagement, so that your lead clinicians are involved in the walk-around program too. And it really shouldn't be something that's delegated throughout the organisation, that it should be seen at an executive level within the organisation. John, you've included active listening and genuine curiosity as part of the critical success factors.
Yeah, I think that's really, really important, and I think that the best way to show active curiosity is to become actively curious, to really be interested in the work that people are doing. Michael West, too, I think many people may have heard speaking. He's a health services researcher, psychologist from the UK, but he talks about this lovely phrase of listen with fascination. That the work that people are doing is very important. It's important to them, but it's important to all of us. And I think sometimes we sometimes miss that opportunity to really listen to the things that people do and really appreciate the complexity and the difficulties on a daily basis that people work through. So I think that, again, and we'll talk about this a little later, it's really important to building the relationship here that we're trying to do with our senior leaders and frontline staff. And I think, paying attention is one of the best ways that can happen.
And as I mentioned, having a coordinated approach to walk-arounds with regards to scheduling and the backup administration, customizing your toolkit to suit yourself and your services, and also making sure it's part, as I said before, part of your existing governance structures, that it's not something that's happening outside your governance structures. And the most important thing is closing the loop, making sure the actions are being followed up on to ensure the success of the walk-around programme.
Sorry, Siobhan, just another question just popped into my head there around governance structures. So how exactly, I know different institutions would have different governance structures and ways that this would report, but maybe for people online, could you give some examples of where the outputs of this would go to? Yeah,
well, some organisations set up a small steering group for the walk-around programme, and you'll see from the Beaumont case study, they did the same thing, just to get the programme up and running, to learn about the process, to see whether the process is working for them. So there's an example there of a terms of reference for that. That's one place. You obviously need to see where the actions that are coming out of the walk-around, where they're going to go. A really good place, I suppose, is your Quality and Safety Committee, if you have one. And as I said earlier, an executive management team, standing agenda item on the executive management team meeting is important. And what you might see is some of the actions in relation to, say, facilities or in relation to, say, hygiene that might come up. They should be really sent to the structures that are in place, whether it's a hygiene committee or whether it's a facilities group. And you'll find with walk-arounds that the early days, they're the types of issues that might come up, and they should be just sent to the various places within the organisation.
I think it's also important to recognise that walk-arounds shouldn't become a way of bypassing our normal governance structures. So, the way that we do get things done or fixed, or whether that's resources or facilities. One of the first times I ever heard of walk-arounds was from the CEO of Great Ormond Street at the time, telling a story about how she was brought on a walk-around in the intensive care unit, and one of the first things they did was they brought her to a sink that had been blocked for a number of days, and they said, look, this is terrible, this is ICU, this is really important that we have it functioning, and so she obviously saw the need, and she, I think after the round made sure that the maintenance came and fixed the sink, but she also then asked the maintenance team to say, why was a sink in ICU waiting for a few days to get fixed, and maybe a sink, on a corridor that's not in a critical clinical area was getting fixed the next day. So there was something wrong with the underlying structure there in terms of how they prioritize maintenance. So it allows people in senior positions, I think, when they see these kind of issues, to recognize, obviously, an immediate need, but what is the underlying systems that we have put in place, and should we look at those and make sure that they're functioning the way we thought they would? So it's a really useful way, I think, for senior leaders to see how things are working, and do they need to change that?
Yeah, absolutely.
A little bit of activity happening in the chat box. Maybe we'll deal with some of that now.
That's fine.
Again, might be pertinent to what we're talking about. But Anne Coughlin from the Rotunda has a question there around EMT. So she's in her year 2 in the Rotunda, and they've avoided EMT in the rounds to allow staff to voice real concerns. But it's hard then when it comes to looking for funding, etc. Do you find EMT on the rounds work better in your experience?
Hi, Anne. Yes, I suppose back to the kind of background of where walk-arounds came from. Yes,
EMT, I presume we're talking about executive management team.
Yeah. I think I think what we've been saying is it's really good to test the process. So I think yes, I think a member of the EMT, if one member of the EMT could be part of the walk around and see if that works for you. I think you do need somebody to be able to make some decisions around what comes up and to also hear directly from staff. So I think yes is the answer, if that's possible.
And I would absolutely agree, and I think it's critical, and I think it's what you're trying to do. Again, it's very important that the executive management team get exposed to people at the front line, and I think they need to be obviously part of building a sense of safety, but I think it's critical that they form a view of life at the front line and become sensitized, I think, to the demands on frontline staff.
And just thanks to Valerie in the NRH, she's talking about how they do walk-arounds, but not specifically for quality and safety, but that might be something you might think about. And also Olivia Wall in CUH has started doing safer patient flow bundle walk-arounds in CUH each weekday to support sustainability of safer at ward level. So it's just interesting to see how maybe walk-arounns are used in different ways.
Yeah, and themed as well.
Yeah.
Very good. Okay. So maybe we'll have a look at some around the whole area of leadership and the teams around that one.
Yeah, I put up my favorite leadership quote there. Our definition is from Marshall Gantz, who's a sociologist in Harvard, and he talks about the importance of leadership is about creating conditions, and I think some of the really critical conditions here that leaders are creating is obviously culture, being the overall condition, but I think as a component of that, I think it's that ability to create, as our kind of comment there from the Rotunda, it's about creating safety, an environment where people feel safe to talk about the concerns that they have. And I think that is a critical role that quality and safety walk-arounds can lend towards achieving. And I think, again, they're not an overnight solution. I think it's something that takes time to build up that level of trust. This is something kind of that in QID I think we're very passionate about, is this idea of person-centered care. But I think that person-centered care extends between the model on the left there, which is person-centered care for those being cared for, but also it's person-centered care as a way of how we work with each other. And I like this idea. It comes from the Mayo Clinic, and it's been adopted by the IHI now, of joy at work. And I think that's something really important. I think that, again, the quality and safety walk-arounds are there to start to look at it, because I think one of the roles, and it can sometimes seem difficult in the current working environment at times to imagine going in to talk about joy at work. But I do think that is a responsibility of our senior leaders, because that's why people have become, have come to work in healthcare. It's to find the joy in it, and I think there are things we can do. We can help them find that joy in work, and I think it's really listening to them. And I think, like we were saying at the beginning, I think it's important to start with the things that people do really well, that they're really proud of, and I think it's not to shy away from the problems and the barriers and the challenges of every day. I think the concern there would be if you don't get the chance to talk about the stuff that people are really proud of and that brings them joy, then you may never get to talk about it later on. So I think it's a great opening question, a great opening place to start is what brings you joy at work. And then, recognizing what are the things that we can do as leaders to make that joy possible. And this is a slide from Jason Leach and Derek Feely, the IHI, and I think it also is an important kind of view on quality and leadership walk-arounds, because it's really reflecting the fact that as work becomes more and more complex, I think we have to think about how we can trust staff who work with us, and how we can kind of hand over as much of the power certainly in relation to quality and safety as is possible. So it's about mobilizing those staff. It's about co-producing with them. So, you know, taking their opinions and ideas. So the first thing in that is obviously hearing them and then working together to put those in place. And I think, you know, one of the ways I think of doing that is to build again that relationship. And one of the key features here, and we've touched on it a number of times, is this idea of psychological safety. Google looked at teamwork and about 2 or 3 years ago, and a big project called the Rework Project. And out of that, you know, they found that the most important feature that matters in good teamwork is this idea of psychological safety. This idea that you won't be punished if you make a mistake. And there's some questions there again that I think are really useful questions when you're doing quality and safety walkarounds. You know, can you encourage this idea of psychological safety? Can people ask questions without looking stupid? Can they be critical without being negative? Can they ask for feedback without being incompetent? And can they be innovative without looking disruptive? And I think it's a kind of a sweet spot to get people to that place where they can do those things and not seem to be, you know, trying to reflect kind of negatively on the organization. But that's really what you're trying to do here. You're trying to create a space where people aren't afraid to talk and where senior people get to hear the most important challenges, but also the best ideas.
Just actually, John, and just that links nicely with the comment from the Rotunda around the involvement of the executive management team, doesn't it? And you know, how, I suppose, in your experience of working with organisations on this, that probably is a challenge in terms of people feeling able to vocalise in front of maybe more senior members of the organisation. Is there anything that you could say, any tips or tricks, or you know, from all of your learning that you've done over the last 2 to 3 years in trying to implement these, that you might impart with the listeners on that?
I think communication prior about the walk-around program is key. So back to this is not an inspection, it's not an audit. You know, that type of communication beforehand. And I know in one site, for example, they went out, they visited, the coordinator actually went out and visited, and people had a lot of questions around the walk-around program when they saw the posters and the leaflets, and she went out and visited and talked to heads departments, fed that back, and just tried to, I suppose, reassure people. So, yeah, the communication is key. Yeah, prior to. I don't know, is there anything else, John?
Yeah, and I think practice makes perfect here. I think it's only natural, perhaps, that executive management team members, if you come from a non-clinical background, this might be a little uncomfortable at the beginning, you know, to go out into these environments and start, you know, asking these kind of questions. Or I think you'd never be doing this on your own. I think you would be part of a team, and I think that's important to recognize that people, you know, don't necessarily have that experience. But I think, you know, it is about this idea of being sensitized to the, you know, what are the challenges of working in the front line. And I think sometimes, you know, that disconnect between, I think, executive management function and the front line is a big gulf. And of course, whenever the guys from the office come down to look, it is generally in the guise of an inspection, or, you know, when something has gone wrong, you know, the people are coming. This is different. This is, you're coming really to appreciate and to learn and to understand and I suppose, like I said, honor the work that's going on.
Maureen actually, interestingly, has flipped it a little bit to say how might you support executive management team members. So she's saying that one of the very strong features of quality safety walkarounds is providing an opportunity for EMT members to meet with staff and patients in their own environment. Can you share insights on working on supporting EMT members, some of whom do not have clinical experience to draw from and may be uncomfortable in those situations, for example, in meeting patients?
Yeah, I think back to John's point around role play, like it's really important that the walk-around team, once it's identified across an organisation, that they support each other, so that there's some role play done around how to ask the questions, who's going to ask the questions, that first piece, I think. Like in one organisation that we're working with, they have a patient advisor now as part of they want to bring them as part of the walk around team. So yeah, there's different ways, I suppose, of supporting, but I think the team needs to support each other, and I think the role play is key. And it might seem very formal, you know, setting up questions, opening statements, closing statements, but I think there's some comfort in that once people are familiar with how to conduct the walk-arounds. I think that helps. And also pairing clinical with non-clinical staff, I think that's good. And I think, again, your coordinator is key.
And again, I think it's when organizations get into the swing of it, it's having a, you know, some sort of a roster so that you know, you're unlikely to learn everything about this from your first walk around. You know, so I think you need to do it a number of times, and I think again the debrief afterwards is really important as well, where people, you know, really understand the experience they've had.
Yeah, and from a practical point of view, in the organisations where it's working well, how often does a walk around happen? How often do they schedule them?
Well, if you look at a lot of the papers around walk-arounds, I mean, I think Alan Franco in the early days, it was once a week, but I suppose that's not always possible. So I suppose what we're seeing is once a month, and I think I suppose things you need to be careful about. The more walk-arounds you do, the more actions that are generated, and I suppose you need to be able to manage those actions and back to closing the loop. So we think once a month seems to fit well with organisations, and it's easy to manage.
Yeah, I agree, and I think you need that level, especially, it's not going to be the same people who go every month. There probably will be a rotation of people who go, so I think that is important. One of the ways of allowing you to do it once a month is to make sure you kind of manage expectations, like Siobhan said, beforehand, that the visiting staff knows this is not going to be, we're going to get everything we ever wanted here, you know, that we want. You know, maybe there's going to be one or two things that we'll agree at the end of this visit that we'll really work on getting, but it's not going to be a way of fixing all of our problems. Because I think one of the things that worries the visiting teams, you know, your executive management teams or senior leaders, is that they will go and then they'll be asked to do things they just can't do in a short time frame. So I think, you know, you don't want to stop the relationship and the learning that's, you know, happening, but at the same time, there needs to be a tempering of expectations.
Yeah. And just Valerie in the NRH has typed in the chat box around the use of the daily operational and safety huddle, and they use that in the NRH to follow up on actions on a daily basis and to make sure that they're assigned to the right person and monitored. So thanks for that. It's just another way of looking at following up on your quality and safety. So sorry, sorry, Dawson.
Just a couple of resources that may help people. This is a very nice short resource from the IHI's Joy at Work paper last year. Again, it's freely available online. And can I just move that on?
No, sorry,
So it's an appendix, I think, on that, and it's listening to learn what matters to you. So this is what matters to you as in staff. And this wasn't kind of framed as quality and safety walkarounds, but actually it is really the same thing. So it's about the do's and don'ts of going out to speak with staff and learn from what they're doing. And if I could just kind of give one plug here for this fabulous book by Edgar Schein, to me is really the book that kind of embodies quality and safety walkarounds. It's called Humble Inquiry, and it's about the idea of asking rather than telling. And again, people are used to, I think, senior leaders and senior management coming to tell people what to do. Whereas I think, you know, if leadership realizes the power of asking the right questions, of really understanding the work that people are doing, and forming a relationship kind of really based on genuine interest in other people, then I think a lot can be achieved in that. It's a pretty short book. It's available on the Kindle, and I would certainly recommend it. I think if you take this approach, I think, to your walkarounds, you'll notice a big change in them. It's a short, but it's a very wise little book, and I think it really is useful. And this, to me, kind of, I suppose, is from my point of view, is a summary really of what I think is going on here, and I think myself and Siobhan have experienced this, that you can look at this very much as a surface phenomenon. So it's leadership, or management by walking about. It's people being out, being visible, being seen, being available to be asked questions. And it certainly shows an interest, when you're going and asking about quality and safety. But there's deeper things going on. I think, people have a real opportunity here to, rather than listening to respond, that's not the role of the visiting team here. It's listening to learn and getting that respect for the work that people do. And then at that deeper level, again, I think there's that ability to create psychological safety where, people will tell you the stuff that's going on. And they won't do that on the first visit. This has to be something that's built over time. And it's that long-term relationship building that is back to that idea of giving away the power. That's really what is needed. And the work we do is too complicated to be centrally controlled anymore. And we really need to have these relationships. And I think this is not the only way of doing that. But I think walk-arounds are one of a suite of tools, again, that I think senior leaders need to have that allows them to really connect with people doing the work.
Perhaps one question that might link into that would be if some people online have started up quality and safety walk-arounds, but are maybe, hitting some walls in terms of sustainability of them. How do you keep it going? How do you keep the interest? Have you any other, from all of your work over the last few years, tips on that? How do you keep the energy around it?
Well, I suppose one of the things to do is to bring in on new team members as well, is to mix up the teams, and that's one thing, and to support the teams, so not just sending them out and leaving them at it. I think the support is really key. And the other thing is to follow up on the actions that have been agreed. And some actions obviously can't necessarily be closed, but I think there needs to be, I suppose, feedback on how the walk-around program is effective, how it's working, and is it supporting the quality and safety culture within the organisation. So I think feedback is key. I think changing the teams around, I think supporting the teams, and I think the coordination and agreeing your ground rules around walk-arounds. If you start cancelling a lot of walk-arounds, it just sends out the wrong message. So just agreeing on that, yeah.
And I agree with all those, and I think it is some of the sustainability is the discipline at a senior level of doing it, and continuing to turn up. And I think if you feel that you're not being sustained, then I think, go back to that idea of humble inquiry. Are we not being sustained because we're not just being curious enough? How do we really understand? Because it's unlikely that the issues have been sorted. I think it's a question of, are we able to learn from what's going on?
We do have another minute or two if anyone wants to frantically type any further questions into the chat box. We have another minute or two if anyone has any questions. But I suppose there's been so much information covered there, lots of practical tips and tools. And one thing might be, where can people go to get more information on quality and safety walk-arounds?
Yep, I suppose we keep everything up on the qualityimprovement.ie website, and that's where the case study is. And that's a really good place to start. I think that case study, absolutely. And I think there'll be a few posters this week at the Patient Safety Conference around walk-arounds. That's good. Yeah.
There is that IHI guideline on the listening conversations, I think, is a good, useful resource. Edgar Schein. I think there is you'll find lots of publications on quality safety walk-arounds that I think are getting into, again, the depth of what's going on. I want to give just one mention to, there was a team on the diploma a couple of years ago from St. Michael's House.
Yeah.
So again, not to get this impression this is only something that can be done in hospitals. This can be done anywhere. They were doing it in a care setting where they visited houses, and they met kind of the staff working there, but also the residents of the house. Yeah. And they really, they had some really fantastic insights into their own culture, I think, and it was really something very revealing to them to do this. And I think they really they learned a lot, and they've taught us a lot, I think, about it. And
And that answers Rob's question there around experience involved. They set up service user groups to meet with the walk around team. And so it was a good example where patients were involved, or service users were involved in a walk around. And I know Beaumont has also involved patients as part of their walk around process too. Yeah.
And probably, it would be useful to go and read those case studies, wouldn't it? Just to get that more in-depth experience from other organisations.
And like a lot of quality improvement, it's learning by doing and reflecting. And I think it is very important to reflect after you do it, but you will not get proficient at quality walk-arounds by reading about them. I think you've got to keep yourself. So and go to places that are safe to start with. Find somewhere that people are mostly on your side. Don't do your first walk around to the most difficult environment. Start in places that you feel you're going to have a warm welcome, and you'll still learn from that, but I think it builds the confidence.
Thanks so much to everyone online for joining. We've had 36 different logins today to today's talk time. It will be available and recorded and up on the QI Talk Time homepage, which is on qualityimprovement.ie. And just before we sign off, and any final parting take-home messages from Siobhan and John, but just to say again, thank you so much to them for giving their time and expertise on this webinar today for us. Really appreciated your time, and it was really enjoyable webinar, hopefully for everyone online. And just to say that the next webinar, it isn't in 2 weeks' time because we have midterm, so I thought it would be best to leave it to the week after that, so everyone will hopefully be back in work. So our talk time is building a model line on frailty. So really it's on health and social care professionals, new approaches to managing frailty, and a lot of improvement work has been going on in Ireland East Hospital Group. So we're going to share that learning, and Fiona Keoghan is going to participate in the webinar with us, and she's Service Improvement Lead for Ireland East Hospital Group. Just checking the last comment there that we're not missing anything. So Patricia Gibbons, this can work in any area, not just hospitals. And that it's worked in social care. We're utilising adult ID and worked very effectively. Thanks Patricia for that. That's great. And Olivia is just saying thanks a million for a good webinar. So
I mean, I hope we've just given people a few ideas. We want to respect all of those walk-arounds that are going around and happening at the moment, and I think some of the ideas here might be things you could try out and procedures that to help you take it, to the next step.
Yep, absolutely.
And there's a nice last finishing point from Louise. Her take-home message was, for me, curiosity will keep the sustainability moving forward. So it's a nice one to end it on. So thanks a million to everyone, and hopefully we'll see you on November the 6th for our next webinar. Thank you.
Bye-bye.
Bye.